Hello, everyone. I'm Associate Professor Chris Onyebuchi-Federa, the founder and president of the OCI Foundation. And this is a speech being delivered at the seminar and the orientation of the NYSC staff from Nigeria's 36 states and the FCT, ahead of the national flag off of the ArOY Youth Health Campaign, otherwise known as the ArOY Health Campaign. This program, as we all know, is being held today, Tuesday, the 19th day of October 2021, at the Chelsea Hotel in Abuja, Nigeria. Distinguished guests, ladies and gentlemen, I crave your indulgence to stand on existing protocol and deliver this message. The OCI Foundation says a very warm welcome to you all. And please permit me to tender my unreserved apologies for not attending this event in person. It hurts deeply to realize that after waiting and working hard for 2 full years for this day, the COVID-19 pandemic and the restrictions it brought meant that I was not allowed to leave Australia for this very event. I did all I possibly could and pushed till the very last minute. Well, though I'm not there today in person, I'm consoled by the fact that, God willing, I will be there for the big national launch by early 2022. And I look forward to hosting you all in person at that very time. Well, ladies and gentlemen, the disappointment of missing out in person has been outshined by the joy of knowing that this seminar, which is the first major step in making our anti-cancer partnership with the NYSC, has become a reality. It is finally happening. Guests, today is an historic day. It is a day that brings us all close to realizing what we believe will be the most impactful healthcare intervention by a non-governmental organization in Nigeria. This is with respect to the vast spread and reach that this campaign offers to Nigerians and the sustainability it uniquely brings to the table. The ArOY Youth Health Campaign is an innovative way of stemming the scourge of breast and cervical cancers among Nigerians. So witnessing this seminar today gives us all the confidence that, as planned, the batch 8 of the 2022 core members will experience the campaign across all the orientation camps in all the states of Nigeria and the Federal Capital Territory. Please, ladies and gentlemen, kindly permit me, before proceeding, to give honor to whom honor is due. We, of course, would not be here today if not for the visionary leadership of the Director General of the NYSC, Brigadier General Shoaib Ibrahim. Just over 2 years ago, in my very last visit to Nigeria, and only just 3 days after the campaign was launched in another historic ceremony for all public senior secondary schools in Anambra State, the DG hosted my humble self, along with the OCI Foundation's legal advisor, Barrister Steve Onyechi in his office. It was our very first contact and meeting with him. But the events of that day will be etched in our memories forever. We were struck by his warm and affable nature. Though it was a brief meeting that lasted for less than 15 minutes, those minutes will arguably pass for the most important 15 minutes of healthcare activities in Nigeria. The historic event of today, ladies and gentlemen, and the lofty and noble dreams and plans we have for tomorrow are all direct results of that symbolic meeting. In that meeting, the DG had the foresight to quickly see through the importance of the message we brought and approve this project within the very first 5 of those 15 minutes. The DG, sir, I have the plaque you gave me as a memento to that very meeting, and I deeply appreciate it, and Nigeria deeply appreciate it. Sir, we are thrilled to see that the passion and energy you displayed that very day have remained unchanged 2 years on. They have survived the threat from the COVID-19 pandemic. They have survived personnel changes, and they have survived the natural threats that come with the passage of time. Sir, Nigerians owe you a lot, and history will forever remember you for this bold move that will save many lives in our dear country. Distinguished guests, the ArOY Health Campaign for which we are gathered for here today is novel in its invention. It is comprehensive in its packaging. It is engaging in its delivery, and it is unique in its offering. As many here would know, the campaign has endorsements and inputs from multiple institutions and professionals across at least 4 countries and 3 different continents. The Harvard Medical School in the USA, which is in North American continent, the Griffith University in Australia, which is in the Australasian continent, the Nnamdi Azikiwe University in Nigeria, which is in the African continent, and the universities of British Columbia and Saskatchewan, both of which are in Canada, the North American continent, all have their experts making various levels of input to this campaign. The campaign is a health promotion initiative of the OCI Foundation, which seeks to introduce anti-breast and anti-cervical cancer teachings into the regular activities of the NYSC's orientation camps across Nigeria. It also aims to include the preventive teachings into the academic curriculum of all senior secondary schools in all of Nigeria's 36 states and the FCT before the end of 2025. To actualize the intervention in schools, the OCI Foundation have reached out to the Nigerian Educational Research and Development Council, otherwise known as the NYSC, which is the body saddled with curriculum changes at the national level in Nigeria. In fact, ladies and gentlemen, you might all be interested to know that just 2 weeks ago, we met the NYSC's Abuja Executive Secretary, Professor Ismail Junaidu. From that meeting, we are very confident and hopeful of having the desired changes ready within the next 12 months. We are also excited to state that we are working with the mothers of the nation, the Nigerian First Ladies. So far, we have held meetings with their members under the aegis of the First Ladies Against Cancer, otherwise known as FLAC, and their presence at this event today indicate how committed they are to this noble cause. Her Excellencies, we say welcome and thank you. Nigerians are blessed to have your caliber of visionary First Ladies at this very point in time, in which we are taking the fight to these 2 cancers. Alongside FLAG, we have also written to the other First Ladies in every state of Nigeria and hope to have them all on board to this project soon. So I urge you all, everyone listening to this message, if you have access to your state's First Lady, please tell her to check her inbox. We have written her and we hope to hear from her soon. I have to add that the Nigerian Cancer Society, the NCS, is officially part of this project. When fully implemented, the ArOY Youth Health Campaign will offer a novel option that will complement the existing anti-cancer measures for tackling breast and cervical cancers and will significantly contribute to the global eradication of cervical cancer. It is also well aligned with a number of items in the United Nations Sustainable Development Goals, otherwise known as the SDGs. This, therefore, is a campaign that we should all be part of. It is a campaign that we should all support. This novel campaign is designed to be wide-reaching, sustainable, and cost-effective. As a matter of fact, since getting the approval from the NYSC, the OCI Foundation has worked hard to ensure that apart from the initial implementation costs, the foundation will, of course, shouldering those costs. This program can run with minimal financial requirements. As a matter of fact, we have a template that, even in the absence of the OCI Foundation, which we do not envisage, this program with the NYSC and the schools across Nigeria will continue for generations to come. To ensure the foregoing, ladies and gentlemen, we have created a virtual training platform developed with the help of experts from some of Nigeria's institutions and the global institutions mentioned earlier. The platform will ensure that the NYSC staff and teachers will anchor this campaign, will receive their best possible training. For the NYSC, these trainings will commence within weeks after the seminar. These trainings are being offered for free to the trainees. And again, the OCI Foundation will be covering almost all the required costs. In addition to the online training technology, the ArOY Health Campaign has additional technologies. First is the innovative Survey Breast mobile phone application, which allows all Nigerians of age to have access to top-notch preventive information against these cancers right at their fingertips. As far as we know, the Survey Breast is the only app anywhere in the world that sends regular and customizable reminders to users regarding breast and cervical cancer screenings. With the help of the WHO country office in Nigeria and the Federal Ministry of Health, we are also working on a plan to include a database in the app, which will allow all Nigerians to locate cancer service providers from anywhere in Nigeria. Ladies and gentlemen, this app is already functional. It is already here with us, and it is available for free in both the Android and Apple smartphone markets. We urge you all to download it, please, and we urge you all to share it among your networks. The second technology-based component of the ArOY Youth Health Campaign is what we call the Gynocular Project. It is an OCI Foundation's initiative that offers a highly subsidized or outright free digital cervical cancer screening for Nigerians. As a matter of fact, we are already working with the FCT's Primary Healthcare Board on this project. They are represented at this event, I believe, and we know that with their help, this service will soon be open to Nigerians. Distinguished guests, ladies and gentlemen, we wish to state that for the records, the commitment we have to this cause is bold and firm. Our desire to reach out to everyone in every nook and cranny of Nigeria is resolute and unwavering. In isolation, we admit that we may not have all the financial or political wherewithal to complete these tasks, but I can assure you that we at the OCI Foundation surely do not lack the courage, and we do not lack the dedication, and we do not lack the commitment, and we do not lack the skills to complete this task. We will not stop until we have armed every Nigerian youth against breast and cervical cancers. We urge you all to partner with us in getting this done. We promise to get it done, and so we will. At the OCI Foundation, as most of you already know, we keep our promises. We do not just dream, we make our dreams happen. In rounding up this speech, ladies and gentlemen, may I remind us all that the OCI Foundation was established in 2016 with the primary aim of bridging and breaking down barriers to the attainment of health and educational excellence among Nigerians. It is formally registered both in Nigeria and in Australia, and the tasks are on a set of tripod, first to promote and advance health, and then to advance education, and then to advance social and public welfare. As you would already have guessed, the ArOY Youth Health Campaign is our signature health project. Our educational scholarships and empowerment programs have also benefited hundreds across Nigeria. Thank you all once again for attending this event. Our partners in this campaign, particularly the NYSC, the Nigerian Cancer Society, the Sweet Home Africa Humanitarian Foundation, and the First Ladies Against Cancer, as well as the media and all other associates and partners to this project, and of course the OCI Foundation's team members, staff, and volunteers. We appreciate you all for the roles in driving this whole dream through, and we say thank you to you all. None of these will be happening today if not for your inputs. In rounding up, may I invite every single Nigerian to join us and become champions of this very campaign in your own little ways. By doing this, you would have all been partnering with the OCI Foundation as we rise by lifting others. God bless you all. Thank you.